Hi, my name is Dr. Liz Cavin. I'm a naturopathic doctor here in Helena, and I'd like to invite you to my first show, and we're going to have a guest today, and the name of my show is Women's Wellness with Dr. Liz. It's a monthly program, and I'm going to be talking about women's health, and I will have guests on a regular basis, women in our community who are also providing services for all of us and services that we'll benefit from in the health arena. So I'm so glad that you're here joining me today for this first show, and I'd like to introduce my guest, Suzanne Morgan.
Hi.
And hi, Suzanne, welcome.
Thanks.
We're going to be talking about hypnotherapy as something that you can use to help you with anxiety, is what we're going to be talking about in particular today. And we'll also talk about how hypnotherapy can help people in a lot of different ways. So, Suzanne, I just thought it would be good to talk about anxiety because I see it in my office quite a bit.
Exactly.
And people will come to me and they might even not have anxiety as something that they've come to ask me for help with. But because I'm a naturopathic doctor and I like to get a thorough history, it'll become apparent that anxiety is something that they're dealing with. And I have my tools that I use to help with anxiety, and sometimes they work and other times I feel like I need more. So I'd love for you to first tell us a little bit about you and what you do, and then we'll talk about hypnotherapy and how it's a little different from counseling, and then we'll talk about hypnotherapy and anxiety.
Definitely. So I was drawn to hypnotherapy, having it in the past myself. I had a very stressful job, and a coworker of mine referred me to a hypnotherapist, and I loved it. I fell in love with it. It is something completely different than the norm. It's really looking at getting into the unconscious mind and shifting thoughts, shifting images, and helping people overcome anxiety and not feel like they're driven on every day of anxious, fearful thoughts. I was living with anxiety due to the stress of my job, and which after 6 sessions with her, I fell in love and thought, this is definitely something I want to bring to people. It's completely different than therapy. I've worked in the mental health field for pretty much my whole career was in mental health, so I worked very closely with therapists and psychiatrists, and even at one point I thought about becoming a therapist, and I thought, I just don't know if that's what I really want to do, and then ended up quitting my job and opening a yoga studio, co-owning a yoga studio.
Oh, that sounds exciting.
Yeah, that's very exciting. It's Loft Studio. And then once that got up and going, then I knew it was time, this is what I want to do. I want to become a hypnotherapist, work with some neuro-linguistic programming, life coaching. So in August, I went to San Diego, went to Bennett Steller University, and became certified.
What was the name of the university again?
Bennett Steller University.
Bennett Steller. Well, congratulations.
Thanks. So I've just recently, in August, graduated from the program and just starting up working with people on anything from anxiety to phobias to overweight to depression. And it's just really getting in and shifting the thoughts and shifting images and beliefs that we have on a day-to-day basis.
Yeah, I had a personal experience with hypnotherapy. Well, first of all, I want to say a lot of people have a misconception about hypnotherapy.
Yes.
They think that somebody's going to hang this little ball in front of you, and then all of a sudden they're going to be able to tell you to do all these things that you don't want to do. And I think we should dispel that myth, because that's not how self-hypnosis works. So can you talk a little bit about how that works?
Yeah, so what hypnosis is it's a very relaxed, almost kind of a sleep state where we're working with the unconscious mind and, not sitting there going like this. It's just getting into a comfortable state and just having the client and the patient in the most relaxed state and feeling comfortable, safe, creating a really good rapport with them. And then the conscious mind will stay awake, can stay alert, while the unconscious mind, some people even fall asleep during hypnosis, which is pretty much the best case, because then your unconscious mind is really looking at, it's listening and it's taking in all the advice and all the suggestions. So it's just a relaxed, comfortable state of mind.
Yeah, and I think it's important for people to recognize that they are in control. So whenever you're doing self-hypnosis with somebody who's trained, such as you are in control. You get to say, no, I don't want to do this, or this is how long I want to do it, or whatever. So
Absolutely.
you're never under the control of somebody else.
No, and in fact, our minds have what we call a guard, and that guard, so if you were, say you were under hypnosis somewhere, even on stage where we all see the hypnosis, the therapist or the on stage, and if that person were to tell you to go rob a bank, you would not do it. Your body, your unconscious mind will not do anything that's morally, ethically against your judgment. Even as much as during a session, you have to be careful. I have to be very careful about, like if I was saying somebody's in a garden and I say, and look at the pink flowers, and there's no pink flowers in your garden, your guard will immediately come back up. You will still stay under hypnosis, but you'll be in a more alert state.
Interesting.
Yeah, so we do have a protective mechanism inside us that won't allow us to do anything that's morally, ethically against our values.
So I actually had the opportunity to do hypnotherapy because I didn't really know it at the time, but I would get stress anxiety. Not stress anxiety, test anxiety. And it would affect my ability to perform on tests. And I was getting ready to study for my board exams as a naturopathic doctor. And I wouldn't say I was suffering from anxiety that was affecting my ability to cope on a day-to-day basis, but I was worried that I might not pass all my exams, and I decided to do hypnotherapy to see if it helped. And I really think that it helped me remember the material, and it helped me do a better job on my exams. So it was a good experience for me.
That's great. Yeah, and that's one of the test anxiety, phobias, like I said, overweight, depression, anxiety, anything anybody needs help with on a day-to-day basis, even if it's setting goals and accomplishing goals, can be helpful through hypnotherapy.
So how long does like a session last?
Anywhere from about an hour to an hour and a half, just depending on what's going on with the person. I like to request 6 sessions, either 4 to 6 sessions, depending on what the person is working through and wanting to do. One session is good in some sense, like working with somebody that maybe is an athlete that wants to win a game. Working with them, giving them the tools of, play to win, suggestions. That might be all that person needs, whereas another person coming in with anxiety may have layers. I think of it as an onion, and you're just peeling back those layers. So the anxiety may go back all the way from age 6. I mean, it just kind of depends. Each person is different. So just kind of working with them and seeing what fits their needs.
Yeah, I like that idea of doing 4 to 6 sessions. It makes sense to me.
Yeah.
If you want to create lasting change. Because like you just said, it could be a pattern of behavior that has been in existence for a long time, and maybe a job, as in your instance, just pushes the person over the edge. Or maybe they have a accumulation of different events in their life, and in the past they could deal with the anxiety, but perhaps now they can't.
Yeah.
So I could see how doing a series of sessions would be helpful, because it would help you maybe undo that anxiety that was there in the past.
And then one of the things I do too is it's called a timeline. So it's walking through, it's looking at present day and finding out, anchoring in those unresourceful anxiety feelings. And when you get that feeling, what does it feel inside? Does it have a color, anything like that? And walking through that, and then walking through a timeline from present day, going all the way back to the first time that you actually felt that anxiety feeling. Some people will go back to age 2, some people will go back to 6, some people will go back to 10. It just kind of depends on that very first time that they actually felt it. And it's amazing to me that your body actually does. Your body and your mind will stop you in your timeline walking back into your past. It will literally, you stop and then kind of know what's kind of going on, and then is this a new feeling, or is this a new feeling or an old feeling. And sometimes they'll be like, you know what, this is an old feeling. So you just keep going back till it's the first time they've ever felt it. And then healing those situations. So that's another really cool thing, is you're healing the past in people's lives as well. Their past is still there, but their images and their beliefs about the past is different.
Wow,
It feels different. And that's something I had done too during my training, is did a whole entire timeline, which was just the neurolinguistic part of really looking at how to reprogram the brain to, because our unconscious mind is, has file folders, and it's like a library, and everything that happens to us is stored chronologically in our unconscious mind. So it's getting into that unconscious mind and helping to shift those images and those beliefs.
Wow.
Yeah.
Well, I'm so excited. I'm really happy to have somebody here in Helena that I can refer my patients to, the women that I work with, to you, because you do the hypnotherapy and you can help them attain certain goals. And like I said, today's anxiety, but as you mentioned, begin new behaviors, work with goal setting, work with weight loss. So there's a lot of possibilities. So do you have a website, or how can people get a hold of you, Suzanne?
I do have a website. So it's Elevate Life is my business, and the website is www.elevatelifemt.com. And then I also have a Facebook page, Elevate Life, as well.
Wow, that's so exciting. Well, I'm really honored to have you as my guest today.
I'm honored.
And I just want to thank our viewers for tuning in. And next month, I'll be talking about herbs for the immune system, herbs that support immunity, because we're in that time of season where we're susceptible, and there's so many different things that we can do to help our immune system be stronger and perhaps prevent ourselves from getting sick if we have sick children at home, or from our job where people are around who are sick. So tune in next month, and if you want to find out more information about me, you can go to my website, lizcavinnaturopath.com, and have a wonderful day.